Why do joint types cause sprains and dislocations? Have you ever wondered why some joints seem to be more prone to injuries like sprains and dislocations? Let's break it down in a way that makes sense. Joints are the connections between bones, and they come in different types, each with its own characteristics. The type of joint plays a big role in how much movement it allows and how stable it is. There are three main types of joints: fibrous, cartilaginous, and synovial. Fibrous joints, like those found in the skull, are tightly connected and do not move much. Cartilaginous joints allow for a bit of movement but are still quite stable. On the other hand, synovial joints are the most flexible. They have a fluid-filled cavity and allow for a wide range of motion, which makes them more vulnerable to injury. Sprains and dislocations happen most often in synovial joints. Why is that? Well, these joints can move in many directions, which means they can be overstretched or forced into awkward positions. When this happens, the ligaments, which are strong bands of tissue that hold the bones together, can get injured. If the ligaments are stretched too far, it results in a sprain. If the force is strong enough to push the bones out of their normal position, that's when a dislocation occurs. Let's look at some specific types of synovial joints. Hinge joints, like the elbow and knee, mainly allow movement in one direction. They can get sprained if twisted or pushed too far. Ball and socket joints, such as the shoulder and hip, offer movement in multiple directions. While this gives great flexibility, it also makes them more likely to dislocate, especially the shoulder due to its shallow socket. Other synovial joints, like saddle joints and pivot joints, have their own unique movement patterns and stability levels, which can also influence how injuries occur. The joint capsule, ligaments, tendons, and surrounding muscles all work together to keep joints stable. When any of these support systems are compromised, whether by trauma or sudden movements, the risk of sprains and dislocations increases. In essence, the design of the joint and its ability to move significantly impact the likelihood of injuries. Joints that allow for greater movement, particularly synovial joints, have more complex structures that can be overstretched or damaged. Understanding how different joint types function can help us better prevent and manage these common injuries.